Hey guys, Dr. Jordan here at Mouw Family Chiropractic. I'm with Dr. Andrew, and we're coming to you with another body signals workshop that we're really excited about. This is a pretty common thing that we see in the office. So today we're actually going to be talking about all upper extremity issues. So cervical spine, thoracic spine. We're going to spend some time talking about shoulders, elbows, wrists. What are the common things that we see with that? So we're going to dive right in. We call this falling apart syndrome. We'll explain why we call it that. But I think you guys will enjoy it. So let's talk a little bit about the anatomy that we see with the upper extremity. So we're going to see things related to the cervical spine, related to the mid-back, or what we call the thoracic spine. We'll also be talking about issues with the shoulder, elbow, and wrist. This is what we call a kinetic chain. You're going to hear that kind of verbiage referenced every so often. So I figured I'd probably spend a little bit of time talking about what is a kinetic chain. So there's a German physicist, his name was Franz Verloh, and what he did is he developed this concept of a kinetic chain. But basically what that means is that every joint in your body is connected to another area. This is why we spend a lot of time, if you're a patient in our office, we talk about how, we want to look at the entire area of the spine. We want to look at the whole body, and the reason for that is because certain areas, even though you may have pain in one area, it may be affecting other areas. So if you look at a kinetic chain, you'll notice that there's certain joints in the spine, and so there's certain central points. So your neck's connected to your shoulder, which is connected to your elbow, which is connected to your wrist. And we'll be doing another body signals workshop talking about the lower extremity, where we talk about the low back connecting to your pelvis, connecting to your hips, connecting to your knees, so on and so forth. So I think you guys get the picture, but the kinetic chain is something that's been around for a long time. And one of the things that we'll talk about is the upper body is really just or your upper extremity is really just a complex series of joints that one area affects another area. And so this is just showing you the picture of the shoulder, the elbow, and the wrist and the hand, how it's all connected. That's the kinetic chain. So talk a little bit about the open chain, what that means, Doc, a little bit.
So in the upper extremity, we have what's called an open chain, which means we have a lot of range of motion and very low stability. So we get range of motion, but we sacrifice stability to do that. And so it's a very open joint, and we've got a lot of range of motion that happens. Basically, what that can lead to is, since we have less stability and we have less muscle support and things like that, we can have more injuries that happen. And especially we see a lot of overuse injuries. A lot of times we're asking this open chain to do something that's not designed to support. And so we get some injuries that can happen. And a lot of times that will manifest itself in a variety of different ways, depending on where it's at. But we can have shoulder pain, we can have decreased range of motion because our body's saying, hey, we have overstressed this, so we can get things like frozen joints and so forth. So kind of at the end of the day, we kind of have this term called falling apart syndrome, and that's because if you've got a problem with an elbow, well, that's going to affect both the shoulder and the wrist, maybe even the fingers. Or you have a neck problem, well, that's going to affect the shoulder, and the shoulder problem having an effect on those lower two joints. So basically, like, one problem in this chain is going to lead to breakdown in the other parts of the chain if we don't get that taken care of. And so what causes this? Well, a lot of times it's just the way we're living our lives. In our modern culture these days, we're not really using our body properly, and it's creating really predictable movement patterns that, and a lot of times it's repetitive. It's the same stuff over and over. We're not using certain muscles. We're not doing certain movements anymore. Because we're not really required to by our modern lifestyle. And so the other thing that it really creates problems is most of our movement and most of our postures and our patterns is forward. So you think about that, like when you're driving, where are you at? You're forward. When you're at your desk, where are you at? A lot of times you're hunched over, right? Your screen time. When you're on your cell phone, where are you at? Well, you're forward. And so, we're sitting down to eat, right? We're looking down, we're forward. So a lot of times, rarely we're extending. Rarely we're in extension and looking up. We're upright. As opposed to maybe our ancestors were hunting and gathering their food. They had all sorts of different movements and postures and patterns that their body went through during the day. Well, ours is pretty predictable, pretty repetitive. So I bet you could find yourself on some of those pictures, and that's what really leads to this. So just a basic overview of the muscles that are involved in this upper extremity. You've got the muscles of your rotator cuff, infraspinatus, teres major, teres minor in the back there. You've got the trapezius that plays a part, lower traps. You even got the lats that hook on in up here, and the erectors play a part as well. So those are probably 8-9 different muscles involved here. So it's good.
One of the most common things that we'll see in the office is something called a subluxation. A subluxation is when one of your spinal joints gets jarred out of a healthy position. When we look at upper extremity issues, a lot of times what we'll see is the areas of your 5th cervical vertebrae. So your cervical spine or your C-spine is your neck. That's the 5th vertebrae in that chain, all the way down to T1. This forms what's called a bundle of nerves. That's called a brachial plexus. And this plexus of nerves branches out almost like roots of a tree, and it feeds the tissues to your arm, your elbow joint, your wrist joint, your hands. Okay, so we'll talk a little bit about carpal tunnel and how that's affected. So we start to see kind of these things stack up where it's the neck, it's the shoulder, it's the upper arm, it's the forearm, it's the hands, it's the fingers. All of these are fed by this bundle of nerves called a brachial plexus. Well, when one of these spinal joints, let's just take for instance a subluxation of the C5 vertebrae, that can affect this brachial plexus. And the first thing that'll happen is that joint will misalign, and that'll create soft tissue damage. And I tell people to think about the soft tissue damage a lot like a sprained ankle. When you get a sprained ankle, it's damaged tissue, but then that tissue will start to swell or inflame, and that inflammation will start to irritate that nerve. And that nerve will create muscle tension. So I have a lot of patients that come in, and you probably see this a lot, doc, is they'll say, oh, it's so tight right through my upper back, or something like, I carry my stress right in this area, is a common phrase that we'll hear, and that's often indicative of a subluxation in that lower neck, upper back. And that muscle will spasm. That will create something called lost imbibition. So imbibition is kind of the pumping action of the spine. So your disc will actually pump fluid in and out of your spine. And your disc, a lot of people think about it almost like a hockey puck. That's kind of acts as like a shock absorber. Well, that's further, something could be further from the truth. What it really is a disc is an organ. The problem is it doesn't have the same blood supply as other tissues. So it tends to break down quicker, and that breakdown or that degeneration or degenerative disc disease is called lost imbibition. It's just a scientific term for it. And then long term, what we'll start to see is degenerative patterns or arthritic issues, and we're going to talk a little bit about the bursa of the shoulder and how that's affected. You maybe have heard of bone on bone. We'll touch on that as well. So the subluxation is really kind of our bread and butter from a chiropractic perspective on what we see in terms of the breakdown of the spine.
There's a lot of different things that can happen when we see subluxation in a place and a joint's not moving properly anymore. We see loss of proper nerve supply, different things, weakness, numbness, tingling can happen. So there's a variety of things that happen: rotator cuff, shoulder instability, bursitis, thoracic outlet syndrome, AC joint pain. There's some of the more common ones. So we kind of showed you the overlay of the muscles. This is like a layer deep into the bones. A lot of these are going to be relating to the shoulder blade or what we call the scapula. That's where a lot of these muscles are attaching, and the movement of this thing is going to be really indicative of what's going to be happening to the shoulder and some of the lower upper extremity there. So
when you look at the shoulder joint, a lot of people think of it, you maybe have heard of like a ball and socket joint before, where kind of the socket's sitting there and the joint sits in there. That's kind of like your hip. The The problem is with your shoulder and where we start to lose that stability is that it's really just kind of a curved edge, and your humerus or this bone right here, your upper arm bone, actually just sits in there. So it doesn't actually connect. It's not a full ball and socket joint. So that's why we see so many shoulder problems is it's really just a curved edge, and that ball just sits in that curved edge, and your rotator cuff muscles hold it up against there. So in terms of rotator cuff issues, what we'll often see, so there's really 4 muscles that make up the rotator cuff, and we call them the sits muscles for the first letter that makes them up. So underneath of your scapula, so if you were to turn around here, Doc. So if you were to take Dr. Andrew's scapula and you were to kind of fold it over like this, what you would see is one big muscle, and that's called your subscapularis. So that sits right underneath of the scapula, and it holds your scapula to your rib cage. And so that's the first muscle of the sits muscles. We will also talk about the supraspinatus, the infraspinatus, and the teres minor. Most commonly with the rotator cuffs, the one muscle that we're going to see most issues with is going to be your supraspinatus. So a lot of times patients will come in and they'll say, oh, I had this deep ache right across the backside of my shoulder. That's often what's called deconditioning of the supraspinatus. So Dr. Andrew touched on this, and in terms of posture, we spend so much time in this position, and what we do is we stretch out that supraspinatus, and we need to start spending more time in extension, and so it's a lot of times repetitive stress injuries. Just to give you an example, I've had a rotator cuff issue from playing baseball. So you think about baseball and pitching, you're making that same motion over and over and over again. So I'm deconditioning the spine because, to be honest with you, I was doing no strengthening at the time. You add on repetitive stress injury, I had a ton of inflammation. I ended up irritating my bursa, and that created a lot of pain and instability. So rotator cuff issues are probably the #1 issue that if you talk to any provider, that's really what we start to see.
So bursitis, basically this is about you've got this kind of soft tissue in your shoulder that helps, kind of like a gel pack, I would say. There's an analogy you can make, but it kind of folds over, and its job is to reduce friction. And so it's there, and so it helps your joint move freely and so forth. But at times, this little gel pack in there, that can get inflamed, and there can be problems with that. It can be painful, create inflammation, things like that. And so a lot of times this will happen from just posture, flex forward like we've been talking about. If you've ever put any pressure on your elbows and you're just kind of leaning forward on a desk or a counter, something like that can jam that bursa in there. So just simple things like that. Like sleeping with one arm up, like
Guilty.
Some people do that, right? And so that can jam that bursa and create inflammation in there. And just simple things like when you're driving and you have one arm up like this, you'll see people driving like that too. Some things like that. Just one posture a lot of times can jam that in there. Like overhead, repetitive movements overhead can bother that bursa as well. So like you've got your painters or people that are stocking stuff overhead that can bother that bursa too.
Yeah. So the other thing to touch on with a bursa is a lot of you have maybe heard of something called bone on bone, right? And so when we look at the shoulder joint, a lot of times it's because there's been so much wear and tear on this bursa, this cartilage, that it's literally to the point where it's bone on bone. And that's oftentimes where we start to seek surgery options at that point. If you've heard of people having bone on bone in their knees or their hips, which tend to be more common rather than the shoulder, but that can happen in the shoulder as well. A lot of times it's because we've worn down this bursa so much that now we have those muscles and those tendons literally rubbing over top of your bones rather than over top of this smooth bursa. And then one of the other things we'll often see is something called thoracic outlet syndrome. We touched on this a little bit when we did the sleeping issues body signals workshop. So in terms of sleep, we'll often see this kind of nerve irritation where that person's tossing and turning. But from a thoracic outlet syndrome perspective, what we do is we have these nerves coming from the C5 to the T1 branching off the spinal cord. And that travels through the shoulder and down your arm. So a lot of times we'll see entrapment of the nerve somewhere in this area, kind of the the base of the neck into the shoulder. And a lot of times what we'll see is that will create issues with your posture. We'll often see this with lifting. So lifting things overhead like military press, that sort of thing, will create that. That creates that nerve impingement that I spoke about. That'll result in inflammation, and that often affects the entire upper extremity. So it's not just going to affect, just the shoulder. This is oftentimes where we'll see that numbness or that tingling, what we call a radiculopathy, from overhead issues. So if you want to test this, a good way to test this is just put your hands like this, and you can just squeeze your hands. It's called Ruse test is the name of it. But if you do this after about 20 to 30 seconds, if all of a sudden you're starting to notice numbness or tingling into your hands, that's indicative of thoracic outlet syndrome. So let's talk about things that cause thoracic outlet syndrome. I don't know about you, but when you're carrying groceries, I tend to be the champion of carrying groceries because I want to do it all in one load. This is a perfect example of when we create traction or tension on that shoulder joint. Those bags weigh the shoulder down, and that can create that symptom of thoracic outlet syndrome. Also carrying kids, so if any of you have raised any kids or holding your grandkids, this can often happen when we're trying to multitask. And then we have kids nowadays. Talk about heavy backpacks. I mean, it's almost like a rucksack is what they're almost carrying. It's 80, 90 pounds of stuff is what it feels like. But you put this on a little one, and over time it can cause that. This is called big purse syndrome. So ladies, big purses can have this. I've held purses that I think are probably 20 or 25 pounds, and I get that you need everything in there for who knows what might happen, right? A hurricane comes through the Midwest, who knows? But you may need to hold on to stuff for that. And then of course men can get it too. We got the man purse, right? This is the classic. Dr. Andrew has his man, no, I'm kidding. I had to pick on him a little bit, but men with their purses, that can happen as well. So we'll often see this. So in terms of self-care, what can people do?
So obviously I'd recommend, take a look at your movement patterns. And if you're doing a movement like with one side of your body more than the other side, like try to divide it up. Think of different ways that you can break it up during the day and not be so repetitive, if possible. And some people that are really concerned about their body and they're breaking down. There's obvious breakdown. I'm saying, hey, look at what what could you do differently for work? Is there a different position in your company that you could say, hey, I'm not going to be doing that repetitive motion and wearing that part of my body so much. So anything that you can do to rest or change your movement pattern is a good idea. Sometimes you just need to rest for a few weeks and just let it heal, and sometimes injuries are more acute, sometimes they're more chronic, and there's a bigger change that you need to make. So just keep that in mind. Exercise. So a lot of times, like we said, we get these imbalances because we're using certain muscles all the time and not using other muscles ever, or you've got a posture, right? And one muscle's getting stretched a lot and it's getting weaker, like Dr. Jordan talked about. So we want to beef up those muscles, the supporting muscles around that area, to get you back to normal and make sure those mechanics are where they need to be so that joint's not breaking down, that area is not breaking down. And then cryotherapy, it's a lot, basically icing. There's different types of cryotherapy, but we want to get cold to that area because that will minimize inflammation and help facilitate healing.
One of the things that's helped me a lot with my shoulder issues, because I've had surgery on my shoulder from a baseball injury like I was talking about, is kind of combining cryotherapy with massage. And one of the things that you can do is if you have any styrofoam cups at home, fill it about 3/4 full of water and put it in the freezer and let it freeze. And then take it out of the freezer and rip off some of that the styrofoam on top and expose about maybe 1 inch to 1.5 inches of that ice. And you can do massage right on top of that. And go until it's numb. I mean, you should be able to poke there, and if you can't feel it, that's a good thing. And what you're doing is you're getting deeper down in the joint. Sometimes an ice pack just isn't enough, especially for shoulder issues, I've noticed. So that can be helpful too if you're wanting to look for cryotherapy and massage. Combining those two it can be helpful.
If you're an athlete too, there's a device called a Game Ready, and so you can put your wrist, your elbow, your shoulder in that thing, and it'll get cold water over that area. It'll compress, which is great in combination with cold, and that's a really great thing to use as well.
Cool. So go ahead, Doc.
So as far as the shoulder movement goes, so you've got several different types of roles and jobs that are happening here. Pivoters, serratus anterior, that's more in through here, this area. Rhomboids is back here. Lower traps back here. Levator scapula up and through here. And then you've got, so those are kind of your pivoters, protectors, the rotator cuff muscles to help protect the joint. A lot of times we overload those to carry things or do things that they're never intended to do, and so we overwhelm those. And so then the positioners, the deltoids, that's more on this side, doing this kind of a motion. Propellers, you have the lats in the back, the pectoralis major and minor in the front here. And so those are kind of the jobs there. And so the pivoters, you get a good shot of his serratus anterior here. So that's this motion. Those guys.
By the way, that's what Dr. Andrews looks like. By the way,
no.
Just sticking out, just like that.
So those guys, they you can see them. We all have them. Some of us we can see better than others. Yes, that's great. And so here's those other rhomboid, a picture of those great ones there. And so some are more pronounced than others. So, we've got some exercises to take you through at the end. So stick with us through the end. We got some great ways that you can strengthen these muscles so they're supporting your joints well.
So let's talk a little bit about the elbow. So we're going to move on from the shoulder, go down the kinetic chain, and let's talk a little bit about the elbow. The elbow is what's called a hinge joint, okay? So it's going to be pretty much flexion and extension, so bicep curls, tricep extensions, that sort of thing. Some of the common things that we'll see is olecranon bursitis, so this kind of pointy edge right here, there's a bursa that sits right underneath of here, so this is your olecranon process. So that bursitis, that inflammation. And by the way, whenever you read a word, so just to give you guys a helpful tip, is whenever you read the word itis, that means inflammation of. So whatever, bursitis, inflammation of the bursa, tendinitis, inflammation of the tendon. So just so you know, when a provider is talking to you, it's important to know what structures they're talking about. We'll also talk about tennis elbow, golfer's elbow, very common. And of course, subluxation plays an effect into elbow issues as well. So the anatomy of the elbow, there's really three bones. Obviously, you have your humeral bone or your humerus, that's your upper arm bone. That's going to come in and that's going to attach into what's called your ulna. Now your ulna is the one that attaches into the humerus, and that's for flexion and extension right here. Now your rotation of the elbow, okay, so this motion of the elbow, this comes from the radius. So the head of the radius, it almost looks like the head of a nail. Attaches right up into the humerus as well, but that's going to be how you get that rotation. So if you're turning a wrench or something like that, that's where that motion comes from. When we see bursitis at the elbow, once again, just like the shoulder has that bursa, we also have that bursal sac right underneath of the elbow as well. This is often, Dr. Andrew touched on this with the shoulder, but putting elbows on countertops, that's how that can get irritated. It's a postural issue caused by physical stress to the area, so literally trauma to that area. Or even a football player running with the football and he gets tackled and the helmet goes right into that area, can create bursitis. So it's obviously inflammation and swelling, which is the itis portion of the word. So when you look at it, obviously he doesn't look like he's wanting to eat it. That looks like a great lunch, by the way, if you remember from our weight loss talk that we did. Proteins, fats are all good in the meal, but you can see how his elbows are on the countertop, pushing down on it, so that can create the inflammation as well as hers there. So more healthy, more polite, okay? Put your feet up on the table. That's the way to do it. So I like what he's doing here. Got the feet on the table instead of the elbows. It's a good way to prevent bursitis at the elbow as well.
Awesome. Tennis elbow. So this is going to affect your extensors. So if you're extending your wrist, your arm at all, like repetitively, like any motion like that, it can, irritate that. They're all going to insert into the lateral or outside part of your arm. And so all those muscles come into one point, and where those muscles come in, those tendons connect, that's a really common place to have irritation and inflammation happen. therefore we've got tennis elbow. So like a tennis player is doing this motion a lot, those extensors, and so that can irritate that area. A lot of times it's overuse. That motion, those muscles working over and over in the same way, it will inflame the tendon, like in that lateral epicondylitis on the outside part, and it's painful. It doesn't feel good. So golfer's elbow is a lot of the same, but it's on the other side of your arm. So it's on the medial side, the middle side, and it has to do with more of the flexors. So if you're flexing your fingers a lot, if you're flexing your wrist like this a lot over and over, even you can get, like if you're doing pulling movements a lot, like that can all irritate that area. And same presentation that we see. I mean, it's going to irritate the tendon. It's an overuse type injury. It's going to create inflammation and pain. So here's some examples of what can create those things. Painting. I mean, how repetitive is that motion, right? And then, if you're doing any job, same way, same thing every day, that's going to be a risk. Overhead work, a risk for all of those upper extremities. Self-care. So you're going to see some similar themes as we go through here. These joints are similar in some ways, and so obviously if it's overuse, you want to rest it. If there's any way you can change your movement pattern, you want to do that. Massage is a great way that can help break up some scar tissue that might have formed in that area. Maybe you've got some scar tissue that's formed, it's restricting the joint, it's restricting your movement in some way, and breaking that scar tissue up and freeing that movement up is going to get you a lot of relief. You want to ice, minimize inflammation as much as you can, and strengthen. Like if it's overuse, you've neglected the use of some of those muscles. So like if it's on the inside, then you want to work more of the outside, right? And vice versa. So those are things to keep in mind.
And we'll give you some exercises at the end that will help you out with elbow issues too. So let's talk a little bit about the wrist. Out of all of these, I would say the two most common ones that we see are rotator cuff problems with the shoulder is probably number one. And then questions about carpal tunnel. We see this a lot, especially with typing jobs, which a lot of people do. Even we're doing a lot of typing, to be honest with you, with our notes and stuff. So when we look at the wrist, we'll talk about the anatomy in a second, but the most common things we'll see is carpal tunnel syndrome, obviously number one. A lot of times what a provider needs to do is they need to figure out whether it's a carpal tunnel issue, like an actual issue at the wrist, or whether it's a cervical spine issue. So radiculopathy or numbness or tingling coming from the base of the neck, from that brachial plexus, can mimic carpal tunnel syndrome. Okay, so you want to be able to differentiate those two. We'll also see cervical subluxation, tendinitis, and then of course subluxations at the wrist. We'll talk about that. So in terms of cervical subluxation, what we'll do is we'll be able to assess for issues at the base of the spine. This is oftentimes where degeneration often will set in the quickest. And the reason for that is with anterior weight bearing, or when your head shifts out in front, that compressive load on the spine creates breakdown of the cervical spine. Obviously there's numbness, there's tingling, there's pain that comes with that. In terms of carpal tunnel syndrome itself, if we have identified that it really is an issue with the carpal tunnel, here's what that looks like. So basically, there's what's called a carpal ligament, or it's called a retinaculum is the fancy term for it. But there's a little ligament, it's a transverse ligament that runs across your wrist, just like this. And there's a nerve called the median nerve that runs directly underneath of it. The same thing can actually happen in your buttocks, called your piriformis muscle, and your sciatic nerve runs right underneath that muscle. So there's a few areas in the body where these muscles or these tendons or these ligaments run really close to a nerve, and that's why they're so common. So inflammation of that area will cause issues. So that median nerve can become compressed when there's issues with this ligament. And so you have a series of 8 bones in your wrist. There's really kind of 2 rows of bones. So one's kind of down here and then the other one's right up here. And what can happen is one of the things we'll assess for is there's a little bone called your lunate. And what you'll see is something called a dropped lunate. So with carpal tunnel, a lot of times they'll tell you, well, you have to have surgery. No, you don't. One of the things that we'll do is we'll actually assess for a subluxation of that lunate. And when you spend so much time in this position typing, that lunate will literally drop down, or it'll shift anterior. And what we can do is we can do some adjusting with that area, and a lot of times it takes the pressure off of the nerve. The only reason that that nerve is compressed is because it's pushed on both sides, okay? Well, we can't really do anything with the ligament itself, but we can sure help the bone that'll compress it. So a lot of times our patients are avoiding carpal tunnel syndrome just by doing some adjusting at the wrist. So obviously there's a lot of things. This is by far, the sitting and the typing is going to be the most common issue. But also, I mean, you imagine running a jackhammer all day, or sitting on your bike like this, that can create issues as well. So it's not just typing, but look at other areas in your life that may be driving issues with that carpal tunnel.
So as far as self-care, so obviously if a bad habit is creating this, or something that you're doing that's bringing it on, like you want to assess, take a step back and say, hey, what in my routine is irritating this? You know, pay special attention, like when it acts up, right? When it's, what were you doing right before that? You know, what during your day? When was it worst? You know, what part of your day or what activities bothered the most? Those are the things you want to start to be aware of. I feel like sometimes people come in, they're like, man, it just hurts, but they haven't thought about like the details of that. So think about that. You can support it. So a lot of times there's taping you can do with all of these joints that we've talked about, just to protect the motion, protect the joints. You know, it's for like, you'll see chiropractors at times, for example, they'll tape their wrists because a lot of adjustments were using that wrist. And so just doing that just takes some pressure off that joint. So it's a simple thing that you can do. I've seen some rock taping and some sport taping that, you know, you'll see on professional athletes as they're competing. It just helps them have that full range of motion with some protection there. So that can be helpful. And then the cryotherapy, again, just trying to minimize inflammation. And inflammation, by the way, is a great response by your body. It's your body trying to protect you. It's your body saying, hey, there's an issue. We need to there's some breakdown of this tissue here. We're trying to heal that. And so you want to pay attention to these signs. You want to pay attention to what is your body telling you, right? If you've got a pain, you've got a symptom, you are inflamed, there's a reason. Your body's saying, hey, something's not right. We need to change something, right? So I don't want you to get the idea that inflammation's a bad thing. It's a very intelligent response. But sometimes we just need to get that inflammation down for you to start to heal. But it's important to remember, hey, if there's inflammation, there's a problem, we need to make a change. Or you keep doing the same thing, what are you gonna expect? The same outcome, right? So, as far as professional care, that's more of like things you can do on your own. Professional care, there's some great stuff out there that I would encourage you to check out and learn about. Number one, obviously, is chiropractic. Can definitely help with all these issues that we've described in huge ways. I love chiropractic because it's such a natural way to help your body, its own healing potential inside to heal your body on its own. Very natural. I love it. ART is a great one. This is more of a soft tissue technique, so they're really going to be working on breaking up adhesions, scar tissue that forms, and restoring proper soft tissue motion and range of motion, and working with the soft tissues, the muscles. So it's really, really great, really powerful. And if your muscle's been in a similar pattern for a long time, it's going to be restricted in some ways, and so they really are great at opening up the muscles. Some chiropractors do ART, some physical therapists do ART, and then massage therapy obviously is a great one. There's a lot of different types of massage, some very light pressure techniques, some very deep pressure techniques. You hear the phrase deep tissue a lot. And there's a ton of things that massage therapy can do. We have a massage therapist that works with us. We see it works awesome hand in hand with chiropractic. I love seeing patients doing those together. There's some really great outcomes that can happen from that. PT, physical therapy, is also great. There's a lot of physical therapists can offer somebody that are going through some of these struggles. They're working more with the muscles and the joints. I think the biggest distinction in chiropractic is our focus is the nervous system, and how the structure of the body is influencing the nervous system, how we can get the nervous system to function at a higher level and have the body healing and functioning at a higher level. The physical therapist is taking more of a deep dive and saying, hey, we have an injury, how do we rehab this? How do we support the joints and structures so we can get proper motion back and strength back and so forth. So we're more nervous system function based. That's the big difference there. And then there's times where you're going to need a medical doctor to assist you with these things. Hopefully that's not your first step, but there are times when the conservative care is just not going to be enough. And so they can certainly help you with this stuff too.
Very commonly with things like tears.
Yep.
Right?
Yep.
So I had mentioned earlier that I ended up having a surgery. So I went through a bunch of physical therapy, a bunch of rehabbing, a bunch of icing and stuff like that, but I had so much inflammation, and not only that, but I had a partial tear of my labrum that was just to the point where, hey, surgery was necessary, right? So we recognize that there's times where you need to take that step, but we always try to go conservative first, because we just find out that that's best, and that's probably the most cost effective too for a lot of people.
So how do you know if you have subluxation? Really great question. I think this is a question that more people need to ask. I feel like sometimes we as chiropractors, we end up as a last resort for people when, man, which we can help people in that situation. A lot we do, but there's so much more that probably could have been done if they would have known more, known what to look for sooner. And so these are some 5 things that we do to really understand if someone's being affected by subluxation or not. And so number 1 is instrumentation. There's certain instruments that we'll use to evaluate the structure of your spine, and seeing where is your spine at? Is there restriction there? Is there heat, swelling, inflammation, those types of things? Motion palpation is another way. So where we're just hands-on, we're feeling the person's spine as they're moving, as we're putting them through certain ranges of motion. We can detect restrictions in motion, muscle fiber tightness, things like that. Clues that will tell us, hey, there's a subluxation there. Static palpation is more like when we're just feeling the spine in a static place. We're not moving it at all. We're just saying, hey, is it resistant to certain pressure? What landmarks, where are they at? Where compared to where they're supposed to be? That sort of thing. Visualization. This is just observing how a person's moving. Do they have a certain posture? Do they have a certain way that their body's trying to compensate? And so just observing them move and their body balance. And then X-ray is a very effective way to look inside and see exactly how is the body aligned, and where could a subluxation be there.
I can't tell you the number of times that I've had a patient, specifically with carpal tunnel, come in and say, I think I have carpal tunnel issues. My doctor wants me to do surgery. And then we take a set of x-rays of their neck, and all of a sudden we find out that there's an issue going on in the neck and not at the wrist. And we save that person from having thousands of dollar surgery because we're able to look at other areas. And so x-ray can be so effective because we can actually see the structure, right? And so that's really important.
And then how do you correct subluxation? Once you know you have it, what do we do about it? And there's really 3 things that we really focus on to get that to happen. And we call it the 3-legged stool in our office, and which means that if you take one leg out of a 3-legged stool, what's going to happen to that stool? We're going to fall over, right? So we need all 3 are critically important for this process to happen. And so we talk about adjusting the spine, getting the spine back in proper alignment, releasing nerve irritation from the nervous system, restoring proper movement and those types of things. And there's a specific rhythm that has to happen to get these changes. A lot of times patients will walk in and these problems have been building for quite some time, and it's not just going to be a one adjustment thing. It's not going to be like, okay, we pop that bone back into place and now it's just going to stay there. It's just not how the body heals that way. And so there's depending on the case and what we find objectively, what's going on with the patient, there's a specific plan that we'll implement with those adjustments to get a person to change and clear subluxation out. Number 2 is the bad habits. So the reality is that there's a lot of things that I do, that Dr. Jordan does, that you do in your daily life. We've got to use our spine. There's stresses that go along with life. That is just reality. But sometimes there's things that we unconsciously do that will drive us back and recreate our problems over and over again if we're not aware of it. Sometimes it's something simple as a posture, like crossing your legs, or like sleeping in a certain position every single night. Now that's not going to kill you one time, but over time, over and over, it will create a big problem. And so we're looking to find those little things, those bad habits in a person's routine and their daily life that are recreating their problem, and that will prevent them from progressing, and saying, hey, how could we tweak that? How could we avoid that? What is something else we could do alternatively to those things, so the person's not getting adjusted and then walking out of the office and redoing it and undoing it. There's nothing more frustrating for the patient and for the doctor for that to be happening. So we really look for those bad habits. And then number 3, that third leg, is exercise. So we talked about that several times as we were going through it. Is we'll have some weak muscles. We'll have some muscles that are tight and restricted. We'll have some muscles that are too loose. And if we just focus on the bones and the nerves and getting those right in place, and we ignore what's around those things, well, that's not going to be as effective. So we really want to strengthen the body so the body's ready to hold that adjustment as well as it possibly can for as long as it possibly can. So there's usually, with most of our patients, there's specific things we got to work on with their muscles, their soft tissues, to help them support their adjustment that way.
And that's a perfect transition, because what we're going to do now is we're going to finish up the presentation portion of it, and we're going to go in and teach you guys some exercises that you can do for each area of this upper extremity. And we hope we caught you guys before you are falling apart, but if we haven't, give our office a call. Our office number is 712-366-1611. We'd be happy to help you. Have a good one.
All right, so we're going to start out with what we call as the push-up plus. And that is really going to be working on stabilizing some of the shoulders, specifically with the serratus anterior here. And so this is a great, sometimes this muscle is very neglected. It's not used a lot in just kind of the typical modern day life. So this is a great way to strengthen that, make sure we're getting stabilization from that muscle. And so what you want to do is you want to start on your hands and knees in kind of a quadruped position like this. And you kind of want to just let yourself sink down into your shoulders. So you're like all of your body weight is just kind of completely down in your shoulder. So you can see that my chest is kind of pretty far forward here. That's all the further I can go. And what you're going to do is you're going to press up through the shoulders, kind of like, some of you've done, I'm sure, the cat-cow. So the cat and the cow like this. It's kind of a similar motion where you're wanting extension through the shoulders like this. And so it's a very small movement. It's not very big, but you're really wanting to isolate that extension there through the shoulders. So that's all it is. It's just get it nice and low, kind of down in through the shoulders, and then just push straight up like this. And you'll be able to feel that muscle engage if you're doing it right. So for me, it's about a couple inches. That's all it is. And so I would do that probably 12 to 15 reps. So this is a muscle that needs endurance, and you can do it two, three sets of that, maybe a couple times a day. You'll really get that serratus going.
All right, so we're gonna do an exercise called wall angels. This is by far my favorite exercise, but it's also super challenging. So if you guys remember growing up making snow angels in the snow, we just call this one wall angels. So all you need is a good old wall, okay? What you're gonna do is you're gonna stand up against the wall. Now the important thing is that there's 3 points of contact. So your head, the backside of your shoulders, and then your tailbone should be up against the wall. And those should not be moved away from the wall whatsoever. Okay, so I got my 3 points of contact. Then what you're gonna do is you're gonna take your hands and put them out in a W shape. And the goal is to get your hands up against the wall, and you'll notice that I'm about 2 inches away from being able to do that. Then what you're gonna do is you're just gonna take your hands and you're gonna slide them up the wall to as high as you can go. The goal is to get to the point where you're straight up and down like this with your hands up against the wall, and then you'll just bring them right back down. Okay, so you're not even holding it, you're just going up and down, just like this. Okay, and what you're gonna do is you're gonna do 10 of those, and you wanna do them before you go to bed, and then when you get up in the morning. And even if you want to mix them in during the day, that's awesome. Get everybody at your work involved with them. But that's wall angels, and what that is that's focusing on bringing your body back into extension. Okay, cool.
Okay, so this one is what we call the reach, roll, lift. And this one's working on your serratus, or your supraspinatus, sorry. Your supraspinatus up here, your lower trap here, those muscles that are gonna help you do this. Because most of the time we're like this, we're forward. These are more backwards stabilizers. So, kind of show you how to do this one. So this one, recommend just getting in like, hands and knees again. And what you're gonna do is you're gonna first, what's called reach. So you reach out with your thumb towards the ground and just extend it here. And a lot of times this is going to be challenging by itself. So just get used to this. And then you're going to reach, you're going to roll. So first you're going to reach, then you're going to roll down with your thumb down, and then you're going to lift. So this is not a big motion either. So again, reach out, roll down, and lift. And you'll feel the back of your arm really start to burn, because you're really focusing on some smaller muscles that you're probably in a motion you're probably not used to doing. So that is the reach, roll, lift. I would say, again, higher reps here, probably 12, 15 reps, couple sets. You can do them a couple of times during the day. That'll get it strong.
Okay, so now what we're gonna do is we're gonna do 2 exercises, and this is going to help with both golfers and tennis elbow. So some sort of tendonitis at the elbow, 2 exercises for that. You're gonna need 2 things. One is some rubber bands, maybe 1 to start off with, maybe more, and then the other one is a tennis ball. So to work on your extensors, so if you remember, your extensors are associated with tennis elbow on the lateral side. What you're gonna do is you're gonna want a rubber band, and all you're gonna do is wrap that rubber band around your fingers and then expand out, okay? And you can see how I'm just doing this. What that's gonna do is it's gonna help to strengthen those extensors. Now, this is not an exercise that you're going to do if it's acute, okay? So if you're actively having pain in that area, we wanna use inflammation, cryotherapy to get it calmed down. But as soon as it's calmed down, one of the things you can do is go back in and strengthen it, and over time, you wanna add more rubber bands, okay? So there, you may get to the point where you're using 8 or 10 rubber bands and you're getting that stronger, okay? So that's for lateral epicondylitis. Now for medial epicondylitis, or that golfer's elbow, you just want to grab a tennis ball, and it's as simple as this. What you're going to do is you're just going to put it in your hand and you're going to squeeze it. You're going to do that, and once again, it's going to be high reps. So I mean, with the rubber band, you're going to want about 20 repetitions with that. Okay, so you don't add another rubber band till you can do this 20 times, and then you'll do the same thing with the tennis ball. Squeeze, hold for a split second, and then relax. Squeeze, hold for a split second, and you can see how my forearm is getting, the front side of my forearm is getting worked just by doing that. Once again, 20 times doing that, and you can just have this by your desk during the day and just be squeezing it and holding on to it. So we hope these exercises help you guys. If you have any questions, don't be afraid to ask us in the office or give us a call, and we can answer those for you. Have a good one.